typically people will take 6 to 12 weeks, month and a half, 3 months, maybe even up to 6 months, where they realize the significant benefit of these injections.
Right.
We've done, at Letterman Kortowitz Orthopedics, we've done about 250 stem cell injections in almost every joint, and also some soft tissue, tennis elbow, interestingly enough, a lot of wrists. People have inflammation tendonitis, rotator cuff tendonitis, and literally...
Do you know anyone that ever had that problem in their shoulder?
Yeah, I sure do. I sure do.
Stem cell patient himself, ladies and gentlemen.
I will digress, and thank you for reminding me. Myself, Dr. Kortowitz, and Dr. O'Keefe, we're all 3 board-certified, fellowship-trained orthopedic surgeons, but we spent a year researching the stem cell options out there, and for years patients were coming and asking us about stem cells. So we really wanted to get well versed, and that's when we chose a couple of specific companies and the human umbilical cord and the amniotic membrane. And sometimes certain situations require you have to double up and do that depending on the pathology. So I was the first one to get this cocktail of stem cell treatment in my shoulder. And what I did 21 years ago, I had a nasty ski accident, and I actually fell forward onto an icy mountain, and it pushed my shoulder out, and I felt it pop back in. It always felt unstable. I had it checked out. Nobody really thought that it needed surgery, but 20 years it degenerated, and I have post-traumatic arthritis. And I'll tell you that this shoulder was the bane of my existence. I would normally be sitting here trying to focus and concentrate when this hot, searing pain was going through my shoulder. I couldn't move my arm. I couldn't sleep without it waking me up 5 times a night. So I was the first guinea pig to get this stem cell. And about 3 to 4 weeks later, I noticed a significant difference. And I thought, well, is this real? Is it not real? 6 to 8 weeks later, 90% of my pain was gone. 3-4 months later, 98% of my pain was gone. It was life-changing. And what's incredible is, as an orthopedic surgeon, I've been doing this 27 years in practice, 5-6 years of training before that. We're taught to fix things. If you can't fix it through surgery, then you don't need my services. But we take a different approach.
Right.
And we want to do everything we can at Letterman Kortowitz to keep patients out of the operating room. Now, in your case, we took you in the operating room, but we avoided the surgery that we were hoping to avoid on the Achilles.
That's true. But it's had a similar story with me relative to the recovery of all 3. But to be fair, you told me the plan. You made me promise you, if you recall, that I wouldn't go back to playing tennis and I would follow your regimen. So we did the physical therapy right there, of course, at your offices, and your physical therapists are absolutely amazing. And I stayed with that. You gave me the scar laser treatment, if you recall. The massage, for me, I think the massage therapy and the ultrasound, I think were the best. I wasn't in pain. That would actually cause a little pain. But as you told me, it wasn't.
Stimulates microcirculation.
And it was not anything that I couldn't handle, of course, but it actually was painful, but especially after. And it, like I said, it absolutely gave me almost no pain whatsoever in the Achilles. Then we cleared that, and my knees were slow, and I was worried, because remember you asked me, you said, knee pain decreased. I told you 25%, and you were kind of bummed and said, that's not enough. So and you kept me off tennis for at least another month, if not 2 months, doctor.
It was.
Why? To me, it's almost counterintuitive. I've gone through a procedure. Why wouldn't me getting back to exercise help as opposed to hurt?
It's a great question. And you were very diligent. You came to our in-house physical therapy. And just like my anesthesiologist who you spend time talking with, I handpick the people that I surround myself with.
Thank you.
And,
appreciate that.
And anybody that's been in business and knows what, is responsible for a lot of people, we're only as good as our weakest link or the people that we associate with. And that's who we hire. It's who we refer out to. And our therapy team is phenomenal. And my patients love my therapy team way more than they love me. But that's okay, I'll take that. But you stuck with therapy, and therapy is a very controlled delivery of certain stressors to the anatomic structure, meaning they know what you can and can't do safely, you and most people wouldn't know, what can I safely do? If you had gone out there after
have
your
no clue.
right, so if you went out there and took a really hard step to lunge after a shot, even a month after the stem cell, there's a chance you could have still ruptured. So the idea is let the regeneration, let the healing take place, let the scar tissue mature. In your case, and we'll talk about it in a second, with the repeat MRI just 3 months after your injection, and in your case, at the cellular level, you have regenerated normal Achilles tissue.
That to me is just ridiculous. It doesn't even seem possible.
But that's where I can breathe easier and know that when I give you the green light to go out there and do what you're going to do, I don't have to worry that you're going to rupture your Achilles. It's incredible. You are, you were the first one, but you're not the last one. We have other patients now with your response that we're doing for Achilles.
Good.
And we've been doing the knees and shoulders and other joints for a couple of years. But when we repeated your MRI 3 months later, and we're going to show this, you see the 50% partial tear. That's half your tendon was not normal. And you're a big guy. So if you go to lunge or take a step off, then it's just not going to stay intact. It's going to snap.
Right.
And the repeat MRI only 3 months later, I still think it's a miracle, looks normal. I mean, normal.
That's incredible. Thank you.